As healthcare workers, we're exhausted.
The chief of emergency medicine at Hamilton Health Sciences says he wishes the public could see inside of his ICU and how they simply can't keep up.
We added 20 ICU beds last week, and they are all full.
What the public can see is the mobile health unit getting set up on site to handle the rising number of COVID-19 patients. It will house 80 hospital beds.
If we don't get a handle on this in the next coming weeks, the projections are expected to be beyond our current capabilities.
Today, long lineups showed there was no shortage of people who wanted their first dose at a vaccine pop-up in a Toronto hotspot. Reba Mai brought her parents. Both are essential workers.
My dad works at a factory, and my mom, she works at a food processing plant. I've been looking forward to this for so long. So when they announced this, like the pop-up site, I was really excited.
There is growing anger from medical professionals who say the latest restrictions don't target essential workers. Most construction sites and factories remain open. Measures like paid sick leave and reconsidering what is essential altogether were what many doctors were hoping to hear from the province.
Certain essential, companies have been deemed essential when they're not truly essential and are at high risk of risking spread between employees and their families. The same group of people that is mostly affected, frontline workers, essential workers, people who cannot afford to work from home, socially distanced, multi-generational homes, marginalized, racialized neighborhoods.
And the vaccine rollout can't stop what hospitals could face in the coming weeks.
We'll have to make some ethical decisions that we could prevent.
His fear of having to make life or death decisions is inching closer to reality. Talia Ricci, CBC News, Toronto.
And we'll take a deeper look at how doctors are preparing to make those choices about who gets treatment later in the hour. Terence McKenna on what we know about the protocol drawn up to guide Ontario doctors. The restrictions that were announced in Ontario Friday prompted angry reactions from doctors across the province, including the government's own advisors. Peter Uni, a medical doctor and the scientific director for the province's COVID-19 science table, says he almost stepped down after they were announced, but he stayed on at the urging of colleagues. And he shared his frustration on CBC Radio yesterday.
Yeah, I feel terrible. I had a crying fit when I was on the call with Danny Brown. He actually tried to comfort me. It's just wrong, it's just wrong.
And we're joined now by Dr. Uni. You heard how emotional you were even just talking about the restrictions released on Friday. But after that interview, the province modified some of those restrictions. So how does that change make you feel today?
Well, it's a first step, but we need to be aware of it's a very small step. With the policing and the restriction of outdoor spaces, the province actually managed to increase inequity even more, and that's not the way to go. They also endangered, the adherence of people to measures in any case. So I'm glad that this was done, but, we still haven't tackled the main problem here. We need to address the root causes if we want to get this pandemic under control. The root causes are mainly related to essential workers and their families. If the essential workers don't get the necessary protection, and this means now an efficient paid sick leave, paying people to stay home if they're either symptomatic or exposed. If we don't have that part, and if we don't make sure that we really have a clear distinction between what is really, really, really essential and what is not, this won't work out. It's very simple.
We have just seconds here, but what's your level of confidence that the right things will be done?
I wouldn't be able to tell. I realize that everybody's in a difficult position, but we need to do the right thing now, and everybody needs to, despite anxieties, confusion, everybody needs to help now, including the provincial government.
Dr. Uni, thank you very much for speaking with us.